Good day. My name is Zuki Zengela. I'm Executive Dean of Faculty of Health Sciences at Nelson Mandela University. So first of all, let me apologize for not being able to attend in person. That had been my intention all along, but unfortunately something urgent came up, which means we are doing this virtually. So my hope is that even though we're doing it virtually, you'll still find value in this. So today we're talking about interns' rights and responsibilities. And the main reason we're doing that is because, unfortunately, even though one would not want this to be happening, we are aware that there are a number of challenges facing interns, which include bullying, but it also includes some interns who may not necessarily be performing according to what is expected. So first of all, we're going to be talking about the responsibilities of interns, and then we're going to move on to rights, and then we'll touch a bit on bullying and what you can do should you find yourself the victim of bullying. So the medical profession is inherently hierarchical. This is what we know about it. It's like that in nature. This implies a social order that is accepted and understood, even though it is not necessarily always written down. The one on top is not always kind and benevolent, unfortunately. And this means that by their very nature, therefore, hierarchies tend to be open to abuse. So looking at the medical intern's responsibilities, what are they? First, a few tips. As an intern, accept that you are still in training. Take guidance from your supervisors and senior colleagues. Ensure that with each rotation, you know what practical skills and knowledge content you need to know. This is why we have the logbook, because it's there to guide you so that you can be sure what knowledge areas you have mastered before you can be signed off by your supervisor. Be true to your ethics and principles and be professional, always. Treat yourself and colleagues with respect. Show equal respect to all patients and relatives, irrespective of status, background, religion, culture, or any other differences you may pick up. Ensure you are registered and licensed to practice, always. Professional behavior includes wearing your name tag, and it should be displayed in a way that is clearly visible, and introducing yourself is also part of that, so that the people who engage with you know exactly who you are and what your role is. So you have to introduce yourself appropriately when you meet patients, when you meet relatives, as well as when you meet colleagues for the first time. Do take meticulous notes, sign and date them, including the accurate time. Be aware of patient rights and also respect those. If you should do a test, a full blood count, liver function test, and so on, follow up to ensure that results are known and documented. It is advisable to sign the results and date them as seen and actioned. Always hand over care appropriately when coming off a shift or duty, and refer appropriately when required to when you're discharging a patient. So those are the responsibilities for interns. What about intern rights? First of all, you've got the right to be trained. You also have the right to be supervised by someone of adequate expertise. So an intern ideally should not be supervising another intern. You have the right to access your supervisors anytime you need them. When you're doing an on-call duty, you have the right to have a named medical officer or a senior person who's on call with you. You also have the right to not work alone in critical areas of care. We're talking about areas like casualty, emergency care, labor ward, theater, or intensive care unit. You also have the right to rest areas, adequate rest areas where you can take a break, where you can eat, where you can take a breather. You also have the right to shifts that are no longer than 26 hours uninterrupted. Your shifts should not be any longer than 26 hours uninterrupted. So what are the different challenges that can face interns, other than trying to keep up with the work, because we know that as the most junior member of the team, often you do the donkey work, as we sometimes refer to it. You can be exposed to bullying. It can be from colleagues, meaning other doctors, senior doctors, consultants, but it can also be from other staff members who are belonging to other professions or disciplines. So bullying can be overt, where everybody can see it and observe it, including you, but it can also be covert. And the covert bullying is often difficult to pin down. And, it's not unusual then for the person who is responsible, or the bully who's responsible for the covert bullying, to, gaslight you. Meaning when you do address it, it is covered or, dressed up as something else, as your mistake, as your impression. So be careful of gaslighting when you yourself feel undermined, you feel powerless, and you feel trapped in some way, because the moment you feel that, it means there is a power ratio in that relationship which is not equal. So we're talking about covert bullying, like, undertones in how they address you versus how they address others. It could be a look or a sneer or a snide comment. Sometimes it's overt, which can then be belittling, especially in front of others, or humiliating in front of others, shouting, threatening, or calling names. There's also the underside or underbelly of medicine that we don't always talk about, and that is the coercion. So when you feel pushed into a corner to do something you don't want to do, when a colleague or senior person crosses professional and ethical boundaries. Sometimes interns can be the victims of sexual harassment, blackmailing for sexual favors, or even sexual assault. And in all of these instances, you feel powerless, you feel trapped, and you feel helpless sometimes because you're too scared to speak out. So what we then need to look at is, what do you do when you are in this position? You feel really trapped and you feel bullied, you feel coerced, you're basically feeling like the underdog who's trampled by someone senior in your team. So look for recurrence and ask a trusted friend or colleague to help you monitor and observe the situation. Gather evidence. You can do this through keeping notes for yourself and keeping any text messages, emails, or WhatsApp messages that may have been sent to you. Do not let things escalate. Ask for a friend to support you, friend or colleague, when you're ready to confront the issue, whether you're now going to be doing it through the Human Resources Department or through direct engagement with the perpetrator. The one advice I have is, if you are going to engage with a perpetrator, never ever do it alone. Never do it in isolation. There must always be a witness and somebody who can back up your story, but also somebody who can support you and help you get out of danger should the situation escalate. Write down the offending behaviors. Make a list of them. Think about the change that you want to see. At that point, when you take this to the Human Resources Department, or you take it to somebody more senior who can intervene on your behalf. Also think about what you would like to happen when you raise the allegation of bullying. Include these or any possible solutions you might think could help to ease the bullying away from you, or to ease the tension between you and the bully. Also include the option of mediation in your list of solutions. And throughout the whole process, remind yourself that the bullying has less to do with you, and instead says something about the limited communication and interpersonal skills of the bully. I shall repeat that again. If you should find yourself the victim of bullying, remind yourself the bullying has less to do with you, and instead says something about the limited communication and interpersonal skills of the bully. And if all fails, you can submit a grievance procedure Again, it's done through human resources. If you're the member of your union, reach out to your union, ask for representation. Judasa is an example of a union that you can approach for representation. So if we then take it wider and look at the responsibility of the medical profession, the first step is for us as medics to accept that bullying within the profession exists, and it is quite prevalent. We also need to look at our own immediate environments to identify how it is that this kind of bullying is allowed to continue, to be perpetuated, and how it actually manifests. What is our role in perpetuating the existence of bullying? Only then can we identify what role, if any of us can play in enabling bullies to own the workspace and to continue their behaviors unchecked. Until we play our part in calling bullies to order as a united medical profession that recognizes and acknowledges this problem, then a bully-free medical profession shall remain a pipe dream. So with those words, I'd like us to focus on what I refer to as the intern's plight. It's a few words that I strung together to try and describe what a junior doctor would sometimes feel like. And this is based on a lot of interaction with junior doctors in the field of training that I've been doing. And also because we launched an intern support program, which is more training than support. So the interns who rotated through the Department of Psychiatry at the time I was academic head could, learn skills which would then help them or enhance their ability to cope as they navigate through the difficult years of internship. So we are now talking about an intern's plight. And I will read as an intern. As I take on the mantle of responsibility, may I wear it with dignity and pride. In action and in essence, may I rise above the system failures. In thought and in deed, may I never lose my passion. In work and in play, may I never lose my voice. For to be passionless is a sure way to kill my spirit. And to be voiceless is a sure way to kill my soul. I'm hoping that this has brought a little light to this subject of intern responsibilities as well as intern rights. And I deliberately included bullying because if one does not include that, then one does not empower interns out there to be aware when they're bullied, but to also know what to do should they face such a difficult situation. Thank you very much for your patience and for listening to this presentation. And once again, I'm sorry that I could not be with you. So my hope is next time we'll be in the same room when we discuss these important issues. Thank you.